I had a great time at the conference recently. Um, it's my first time in French Lick and probably not my last. The air smelled really good out there. I don't know if anybody else felt that way. And because I can't see anybody, I would love for some folks to just communicate in the chat. Let me know that you exist and are on the planet because I'm normally used to seeing people's faces, and right now I can't see any faces whatsoever. So give me some signs of life in the chat. Let me know you're alive. Nice. Thank you guys. I if you're not familiar with me, my name is Johnny Crowder and look at this. We are live. We are live. This is awesome. This makes me feel so much better. Um if you're not familiar with me, my name is Johnny Crowder, and I am the founder and CEO of Cope Notes. So I'm going to explain like what we do, how it works. But I first, just in case you weren't at the conference, I can share why I do this work because I think it's really important. So I'm what's called a certified recovery peer specialist, which means that I grew up with um, multiple mental health conditions, and it took me forever to get into treatment. So when I was young, my parents didn't believe in mental health, so they were trying to put it off as long as they possibly could. And if you had a medication for me, I wouldn't take it. I'd dump it down the toilet. If you had a book that would help me feel better, I would rip it in half. Like I did not want to focus on what was going on with me. And I was very treatment resistant. I started treatment in high school, actually, after running away from home. And I went to school for psychology and started working in behavioral health full time. I mean, I love learning about this stuff. It's like my favorite topic. Like I was in psychology courses, college level psychology courses in high school. Like I just fell in love with the topic. So that's where a lot of this is coming from. Like today, I'm going to talk a little bit about peer support, which is like what inspired this. I'm going to talk about health education, which is what sparked that curiosity in me. And I'm going to share a few slides. I think the presentation part won't, this call, I'll be shocked if it takes an hour. So it's not going to be really long. I'm going to keep it as short and sweet as possible, share a little bit about the work that we are doing and how we can help rural communities. And then I'll answer some questions in the chat, and hopefully everyone has a little extra time for lunch afterwards. So I'm going to share a slide, and do me a huge favor, because you guys were so good in the chat earlier. Just let me know if you are seeing this on your screen appropriately. Man, I missed.
It looks good. I don't know if you can make it full screen, but we can see it very well now.
Okay, let me try. I have an idea. I have a great idea. Why don't we try? Why don't we try this? Maybe not perfect, but maybe better.
No, that's larger. Thank you very much.
Love it. Awesome. So, if you're not familiar with Cope Notes, this is in one sentence. Whenever I meet someone, they can't describe what they do in one sentence. I'm like, oh man, please summarize it for me. Give me the short version. This is the short version. We provide daily text messages that improve mental and emotional health. That's the easiest way to describe it. There's more psychology and technology behind it, but high level, this is how you would explain it like to your nephew if they asked after work, how was work? What'd you learn about? The problem that we are solving primarily is that honestly, we have focused, and I think it's good to focus on people who are in crisis. Like I have been in that high acuity bucket many times, and I needed resources available for me. I think the challenge there is that we tell people like, when things get hard, just reach out. And in a perfect world, everybody would do that. But the fact is, most people don't take action. A lot of people will. I had mentioned in my talk at the conference that the average length of time between onset of symptoms and engagement with care is 11 years. So people wait a decade and change to actually engage with the thing that will help them. So in the real world, a lot of people don't reach out, and by the time they do, providers are already overwhelmed. Long wait lists, high turnover at the provider level, and the demand is rising. So we're a big believer in prevention and intervention. Like I think about my life, how different my life would have been if someone offered me support 6 weeks, 6 months before my first suicide attempt. Like how different my life might look. So we're really big on serving diagnosed and undiagnosed. Like we'll work with a hospital system, for example, and we'll serve people who are in there for like severe mental illness, and we'll also serve pregnant and new mothers and low income teens and people with diabetes and Alzheimer's and like all sorts of different people because the idea is that like yeah, I love that we're in a system of care that is focused on people who are in behavioral health crises, but I just think, man, the opportunity to drive change is so much larger than this niche of people who are in that crisis mode, and prevention is part of that. So up here on the top right, you'll see that stat, which you hear all the time, that more than half of mental illness goes undiagnosed and untreated. So we don't only serve people living with a diagnosis. And we get this question a lot, usually about this time in the chat. Someone will be like, "Hey, I'm on the App Store and I can't find Cope Notes. Maybe it's not that popular." And actually, you can't find it on the App Store because it's not an app. So there's a few reasons why we just use text messages. There's no downloads, there's no passwords to remember, there's no software updates you have to keep up with. Your personal data is not being sold to Apple and Google. And also, if you're not very tech savvy, it's totally fine because this is just text messages like you'd have in your phone with a friend or family member. There's a few reasons why we chose SMS instead. So we send text messages on the bottom left, in part because it is 50 times more likely that you will open a text message than an app notification. So, like, if we're in the business of delivering health education content and interventions, you have to read them for them to have a positive impact. So we want to deliver it in the way that most people prefer to read. And there's this big misconception, like in the center here under preference, there's a misconception that it's just like youth and young adults that prefer text messaging, but actually, from millennials to seniors, 97% of American adults prefer text messaging to any other communication method. And this third piece I think is pretty important, especially when we're talking about rural communities. There are tens of millions of Americans who use non-smart cell phones that can't even download apps. And a lot of people are facing implicit bias in care because like they're not super tech savvy. I mean, I think about my dad technically has an iPhone because my brother bought him one, but you could not pay him to use any of the smart features. He just will call, text, call and text. Those are the two. So we want to make it exceedingly accessible for anyone to use digitally, especially when they're really spread out in these rural communities. So we tell people like there's no smartphone required, there's no internet required, there's no data plan required. Even when we text people, we use a like government approved toll-free 888 number. So even when we text you and you text us, you aren't even charged if you're on like a pay-as-you-go plan without unlimited texting. We inherit those costs. So it is like as accessible as you can get in the digital world. And this right here is probably the page that you were hoping I would start with. So if you have been checking emails and folding your laundry, stop for a moment and look at this slide because it's the one that explains how we do what we do. I mentioned at the beginning that we use text messages to improve mental and emotional health, but this is what it actually looks like in action. So there's an example text message actually in the center there. And you can see these are the four pillars of what we do. So peer support, positive psychology, brain training, and digital journaling. So we're sending one text per day at a random time that contains health education content. So think psychology fact, a journaling prompt, maybe Allie's getting an exercise. And these messages are just a couple sentences long. They are written by real human beings. Listen to me, not generative AI, not ChatGPT, real human beings with firsthand lived experience overcoming stress, anxiety, depression. So, written by real people, reviewed by clinicians, based on proven psychology. So, this is health education content written by real people, reviewed by real people, and delivered at random times so that you never know when we will text you or what the text will say. And listen to this, no two people ever get the same text at the same time. So, you never know when we'll text you or what it will say, but you do know that you're the only person in the world to receive that message. at that time. And what's really cool is when you journal back and speak freely in that text thread, it's just like a physical journal. So it won't report you to anybody. It won't keep a record for like your health records or be reported back to your employer. This is confidential and anonymous, so much so that when you sign up for Cope Notes, we don't even collect your name. We don't have any of your protected health information on file. We just have a phone number that we can send messages to and receive messages from. That's it. And that's why people feel safe journaling. Like some people will journal 100 times a day. Some people, I don't journal for like months at a time because I have a separate journal. Probably shouldn't have said that since it's being recorded, but I have a separate journal that I use. But some people use that digital journaling feature on a daily basis. And the reason why they feel comfortable doing that is because their journal entries are not tied to their health data. That confidentiality, that anonymity is paramount to what we do. And I should mention, because I know who's watching this, we do have a partnership with 988 and we outsource all real-time conversations to them. So if someone is journaling that they might be in danger or someone else might be in danger, we help that person access the appropriate real-time resource, which for us is 988. This page, now I'm going to try to keep this short and sweet, but this is what I went to school for. I literally gave a TED talk about the neuroscience behind Cope Notes. I'm not joking. You can look it up. This is maybe one of my favorite corners of psychology. When I was in school, I studied abnormal psychology and neuroscience is so fascinating to me, like how and why the brain changes, the idea that you can change the way you think. I became obsessed with this when I was in school, and I never dropped the obsession. I still think it's interesting today. And basically, the reason why what we do works is because we're doing something called ecological momentary intervention. This is going to be a little sciencey for some of you and very interesting for others. But basically, what we're doing is we're taking like something that you might learn in therapy, like a CBT session or something, and you're chopping it up into bite-sized pieces and delivering it in non-clinical settings. So this is like at school, at work, at home. And these little micro interventions, these little 10-second interruptions to our automatic negative thought actually train the brain to form new neural pathways and coping skills. So this is like we call it a set it and forget it mental health resource because you make one decision to start using Cope Notes today. And every day thereafter, we initiate engagement. So we are proactively reaching out and educating people, giving them tools so that 6 months from now, when they experience some challenge, they are far more equipped to self-manage those symptoms in that circumstance because they've spent 6 months learning a little bit every day how to do so. We do serve youth ages 12 and up, and we serve adults of all ages. So we have personal subscriptions, which is like you can go on our website and sign up for yourself if you want. We get a lot of questions about friends and family, even at conferences, like at the Rural Health Conference in French Lick. People were like, "Hey, can I get a subscription for my daughter or for my wife or for my brother?" Stuff like that. We do have personal gift and family subscriptions on our website, which is just copenotes.com. They're all extraordinarily affordable. You're talking a full year of evidence-based daily mental health support proven to reduce stress, anxiety, and depression for less than the price of a single therapy session. A full year of Cope Notes costs less than one therapy session. So if you're looking for bang for buck, this is that. Now, but the main reason why I'm sharing this with you guys is this enterprise side. So we work with school districts, businesses, nonprofits, governments, hospital systems, providers, like literally hundreds and hundreds of organizations. We're supporting either their staff and volunteers, like the people who are actually doing the work, or their clients and communities, like the people they're serving. And I'm gonna skip this page, but there's really like this only really matters if we're gonna like work together and you want to know like, hey, what's the reporting look like? But basically, we do a lot of reporting. So we'll show a group like how many messages have been exchanged, all anonymous, by the way, but how many messages have been sent and received, how many people have signed up, and then you can actually see on a chart like, oh, we paid this much for Cope Notes, and then that means we've exchanged this many messages with this many people on our network. And it's a way for us to show the partners that we're working with like, hey, this is the fruit of this partnership. And we'll do, not pictured here, but we can talk more about it if you have questions. We do outcomes analyses. So where we can show like, this percentage of people that we've served through this contract report improved mental health or improved sleep or less reliance on emergency behavioral health services, like all sorts of stuff that we can measure through our outcomes analyses. Oh, and actually, I should point this out in the top right. This is super easy to launch. There's like no complicated tech integration. You don't need to loop in your IT people. This is literally like we share a URL or a sign up sheet or a QR code or something, and people just type in their phone number and press enter. So it's like there's really nothing to set up. And sometimes people would just send us a list of phone numbers, and they're like, "Hey, sign up these 1,000 people, and we can do it in a heartbeat." I'm almost done with this. I'll share maybe two other quick slides, and then I'm done sharing and would love to answer questions. Um, our I'll skip the testimonials here in the interest of time, but if you go to copenuts.com, there are plenty of quotes from groups that we've worked with, like on large scale projects, and as well as like individual people whose lives we've impacted. But you would be shocked how much just these tiny little messages can really change the course of people's lives. And at the bottom, you'll see some of our partners. So we work with all sorts of groups, large and small. And there's a couple things on this page that I want to point out. The first is 86% of users report improved mental health within 30 days. If you are from the behavioral health world, you are probably thinking that is ridiculous. That is way too high of a number. Like there are, like therapy doesn't even have that high of report of improvement. And if you're skeptical, I totally understand. I am a natural born skeptic. And then this is, by the way, the 86% is qualitatively sourced from tens of thousands of people. But if you're like, oh, qualitatively sourced, great. That's all self-reported stuff. But I want to see like if you're a health professional and you're like, I want to see the published in medical journals, like university study research institution, like show me the quantitative data, the evidence base. I can do that. So up here on the left, you'll see decreased depression, anxiety, and stress. This is really important because we measured this in a study that I'll show you. We measured these outcomes for people living with these symptoms. And you might think like, well, Johnny, if you built a mental health resource, I hope to God that it is going to decrease depression, anxiety, and stress for people who experience that. So maybe that's impressive to you. Maybe it's not. I'm excited about it, but what I'm actually more excited about is what's right below it, where it says increased resilience, emotional intelligence, focus, coping skills. These outcomes were measured for, drum roll please, people who were living without severe mental health conditions. This is big. This means that you can take one resource and give it to two separate groups of people, which I'll show you, and anticipate positive health outcomes. So this is actually the research study. We have two research studies that are published in medical journals. The first is it is published in the Journal of Medical Internet Research. It's a tongue twister. And the second, that's what this one is. The second one, this is published in the Journal of Mental Health. And this is the analysis, like the research summary. And there were two groups that we did studies or that we studied. The first was people trying to get mentally healthy. So these were people with a higher score on the PHQ-9. So these are people in the moderate to severe symptom range. They were managing depression, anxiety, and stress. And then the other group was people who were trying to stay mentally healthy. So these are people in the mild to moderate symptom range, many living without a diagnosis at all, and low scores on the PHQ-9. And what was really cool is that in 10 seconds per day of these microinterventions, Cope Notes measured decreased depression, anxiety, stress, and increased emotional intelligence for people trying to get healthy. So that's that first group. And then for the second group trying to stay healthy, Cope Notes was improving overall coping, emotion-focused coping, and problem-focused coping skills. There are more outcomes that couldn't fit on this one pager, but the idea is that this is if you're like me, I'm looking for the smallest lift, especially in my recovery. When I started, I wanted the least amount of effort and commitment required of me for the greatest amount of recovery. Like I wanted a force multiplier, and this is that. It's 10 seconds per day, leading to measurable positive health outcomes, whether you're in the mild to moderate symptom range or the moderate to severe. And the last thing I'll share with you, there's plenty more on our website, but my goal was to keep the presentation part under 30 minutes and then to have the rest of the time for questions. So this is the last thing I'll share with you unless somebody else asks a question about something else. I need to screen share. I can pull it back up. But this page explains where we fit into the continuum of care. So when I first built this, I have a lot of friends who are like therapists and counselors, and they were like, "Are you trying to get us like kick us out of the continuum of care? Are you trying to put us out of a job?" Dude, therapy changed my life. Like without my therapists and counselors, like there's no way I would be alive today. So I have no interest in dismantling the system of care. I want to strengthen the system of care. And really that's why we very purposely describe ourselves as we are a gap filler. We all tell people like, if someone's seeing a therapist or a counselor is like someone going to the dentist and having someone like clean their teeth manually, we are the toothbrush and floss. We are that small, simple, cheap, easy thing that someone can do on a daily basis to maintain the progress they make and make, hopefully, the dentist job a heck of a lot easier when they go in for a visit. So we tell people like we are a gap filler. We are for the in-betweeners, for the people who fall in between the cracks in the continuum of care. So on the left, I'll walk you through these big gaps that we fill, and then on the right, I'll tell you the things that we do for organizations that we work with. So on the left, there are three main gaps that we fill in the continuum of care. And the top, I don't know if this is big enough on your screen, but I can zoom in. The first one is pre-care. These are people, by the way, I've spent many a month slash year in each of these gaps, so I know them very well. Pre-care. This is the gap for people who are stuck in wait lists, who don't think that they're struggling quite enough to take any real action. They're like, I can probably limp this off. And we're people who are unwilling to engage with care because of their own self-stigma or social stigma, their budget, their own privacy concerns or scheduling issues. Like there are all sorts of reasons why it takes that 11-year period for someone to seek care. So there's a lot of people stuck here who are saying, oh no, it's just my knees that are bothering me, or oh no, it's just my divorce, or oh no, I'm just not sleeping well. It's some of those people that we make the biggest progress with because we're normalizing that help seeking and building that like symptom self-management, those health education skills that are going to help them manage and also build the accuracy of their self-report so they can go, yeah, it is my knees, but I also feel really anxious that I'll never heal. And that anxiety feels paralyzing. Or it is my divorce, but it's also like this crippling loneliness that I feel that feels like sort of a mid-grade depression, like helping them identify those things so that they can actually get help for them. This second gap here is the intercare gap. So this is tricky because a lot of these people sneak by. It's for people who already started participating in care, who either need supplemental support between sessions. Like for me, when I was in therapy, it was not the hour in therapy that was tough. It was tough. But what was tougher was the 6 days and 23 hours in between, where I was like out in the wild, in the elements, in the world. That was tough. So people who need supplemental support between those sessions, like me, or people who start strong, this was also me for a while, people who start strong and slowly become less engaged. So maybe their med adherence is slipping, maybe they're skipping a session or two, maybe they're just like kind of clocked out and they're like, yeah, I pretty much got this, or this is less interesting to me now than it was. So helping keep them engaged long term. And then this aftercare piece. These are people, I have been all three of these, and it's funny to reread this and like relate to my younger self. Um, Aftercare. This is for people who have graduated out of a formal care setting, but still need ongoing guidance, support, and encouragement as they adjust to their new normal. I cannot tell you. So I live with PTSD, is one of my diagnoses. And I cannot tell you how many times I've been like, I'm all done with PTSD. It's over. And I don't need any more treatment. And I'm going to skip off into the sunset for the rest of my life. And then something happens in my life and it kicks up all that dust. And I'm like, yes, I actually do need a little bit of help. So Cope Notes really helps fill those gaps. And if you notice, in between those, like right here, I don't know if you can see my mouse, but right here between pre-care and intercare, and right here between intercare and aftercare, that's where y'all are doing a lot of the work. And all we're trying to do is plug these gaps so people don't fall through them. And then on the right, wow, I'm going to make it inside of 30 minutes. Go, Johnny. On the right, you're going to see the big five. So these, we say that we automate the five most neglected components of the continuum of care. And this is prevention, which we already talked about. It says what makes more sense, proactively supporting the undiagnosed or waiting until they ask for help? Kind of a rhetorical question. Intervention. So why limit care to clinical settings when most of our challenges arise at work, at school, or at home? Engagement is number three. How do you keep people engaged between visits or win back the folks who aren't responding? Guilty. Number four, follow up. So, what happens after the session, the call, the crisis? Who checks in with them the next day, the next month, the next year? And importantly, will they answer when you do? And then number five, maintenance. So, how are people locking in and building upon the progress they've made over the long term? So, I am only going to stop screen sharing now. Well, actually, I'll put this up. So there's a on this page here, you see our website, which is copenotes.com. You see a QR code, which you can scan to go right to our website, and you see an email. So I will, oh, and an example text message. And actually, if you go to our website, let me pull up the chat again and see if I can put a link in the chat. Am I able? It says host and panelist. How do I send it to everybody? Allie, are you?
And so, yep, you just hit the little caret down next to it,
Hmm,
the little blue thing that says host and panelists, and there should be one that says everyone.
no, it just says host and panelist, and then you.
Well, then shoot it to me and I will punch it out to everybody.
Just send this link right here. So I'll send that, which is a link to our website. I'll send this. The second link you're going to see is a link to a free week of Cope Notes. So that's just so everybody here can try it for free. And this will not auto charge you. This is just a way, like if you were at the conference, you might have actually already tried it. But if you didn't get a chance at the conference to try it, that's how you can. And then I would love to use the remainder of our time together, even if it's only 5 more minutes, answering any questions. So if you guys have questions, if you can put them in the chat, or if I missed some, Allie, if you could read them to me, that would be awesome.
So we haven't gotten any in yet, but I will also say, so I told you guys about the chat and Q&A functions at the beginning of the meeting. Please send those questions in now. But also, if you prefer to ask your question verbally, you can use the raise hand button, and you can use that. That's under the React. It should be under the React. Though you can also hover over yourself, and you should be able to raise your hand and we can unmute your line, or you can chat in, of course, always. Hey, I'd like to ask my question verbally. I will say while we wait for questions, comments to come in, we do have one more survey to launch to collect a little bit more data. This one, hopefully not too overwhelming, only 2 questions. If you could all take a quick second to fill that out while we wait for questions to come in, I would greatly appreciate it. And I will also say, Johnny, thank you so much for, not just sharing about your own situation, but also sharing the service. Um, what an innovative and interesting approach. We know that the mental health crisis is on the rise everywhere, but we are certainly feeling it very acutely in rural where our resources are so limited and the stigma is still so, so great. So, what an innovative approach to potentially meeting those people where they are.
I appreciate that. I am super passionate about this, if you can't tell. Like, one of the things that I've had to learn to care more about, because when I got into this, you guys got to think, like, you can probably tell by looking at me, I grew up like playing in hardcore and punk and metal bands. So, like, that was my whole world. So I was like, money doesn't matter. And then I started working in healthcare and they're like, oh, it does matter. Like part of the problem with healthcare is that like money can be really tight and like things are really expensive. So I wanted to make this extremely affordable. And Ali, you had mentioned something that made me want to bring up like this is for many organizations, it is a cost saving measure. So like we have a case study with, oh, actually, let me show you this. Can you guys still see my screen? Coconuts.com/.
Yep, we definitely can. And we
Nice.
do have some questions coming in, so
Oh, nice. Here, I'll share this hyper quick. Can you guys see this? The United Healthcare.
yes.
Okay, awesome. So this is a case study from we are 3 years into a state Medicaid contract in Florida with United Healthcare and Optum. And there's a bunch of things on this page. I don't have to show everything, but I wanted to show you a few things on the left. So not only did a vast majority, 82.3% classified Coke notes as helpful or very helpful in their health journey. And this is across not just people with mental health conditions, by the way. That's an important distinction. But the reason why I pulled this up is this, a 29.4% reduction in need for emergency behavioral health services. A 29.4% reduction. This is huge. We are all for groups that they're like, hey, we not only do we not want to spend a ton of money on resources, that's why we priced it very low, but then we want to work with groups who are like, hey, we're actually trying to cut costs. Like there are things that we have to do for people that are very expensive, and if we could do less of that, then we'll be less tight budgetarily. So I really wanted to point that out. I'm glad you brought that up, Ali. And I see a question from Laura. If you start with the annual basic subscription, can you upgrade to the premium later? Yes, you can literally text upgrade. I think it's upgrade, or you text premium or something like that. Um, wow, I think you text premium and it will send you like a little checkout thing. But yes, it's very easy to go from basic to premium, and then if you want to go back to basic afterwards, you can. And someone said, I love your passion. Thank you for loving it. I can't turn it off.
We did get a question in the Q&A. Can you talk a little bit about what the back and forth looks like in the text message? Is the same person always responding? How do you determine when to continue the conversation versus when to refer someone out?
Yeah, there's actually, check this out. I hope this link works because we just updated our website. Let's see. Oh, right here. Awesome. Okay. It says, so we get a question on like what happens when I text back. And this is the best we've spent forever trying to write this out. So this is the best way to describe it. I'll read it out loud. It says, you can text us a million times a day if you'd like. In fact, we encourage it. Say whatever you want, whenever you want, or nothing at all. It might seem weird at first, but after a while, it'll feel natural and provide some serious relief. Remember, this isn't a real-time conversation. It's an anonymous, confidential journal, a safe space to vent and speak your mind without worrying about the repercussions. And just like a physical journal, we're big on privacy, so we'll never reply, share, or judge anything you say. Why? Because it's healthier for your brain that way. Every time you text us, you're engaging in a mindfulness practice called digital journaling. By speaking freely without being conditioned to receive a reply in return, you're strengthening three crucial components of your mental well being. The first is your emotional intelligence. The second is your emotional independence, which means that you're not reliant on like a positive or negative consequence for committing an action. And then the third is your self-report, which is your ability to assess how you feel and what might help. So I will tell you, like the first time you journal in your Cope Notes text thread, you will get a response that says, like, hey, remember, this is just like a physical journal. Like we're not reading it, we're not replying to you. This is your safe space to speak freely. It's a confidential journal. And if you would prefer to speak with a real trained counselor in real time for free anonymously, we can connect you with our friends at 988 who love hearing from Cope Notes users. They would be happy to talk to you. So, whenever someone journals something that would indicate that they are in need, they'll get an automated response that says, hey, we're not reading this. We're not reading what you just sent. However, we did train our library to identify when someone could benefit from additional support. And if that is the case and you would like to speak with someone, here's how you can do it. And if you would not like to talk to anyone, keep journaling because that's exactly what this is for.
Thank you. That's very helpful. See, any other questions? And I'm looking again at the attendees if anybody wants to raise their hand and ask their question verbally.
Allie, I'll say this, like you, if you can, could you put my email in the chat too?
Yeah, of
And
course, I can do that right now.
It is very common, by the way, for me to like do a call like this and for people to not ask questions here, but then they'll email me a question afterwards. That's totally fine. I'm very easy to reach via email. And I'll say this, like I don't do this for fun. What is fun? But I don't do it for fun. I do it because like if there's 100 people on this call, I would love 100 emails at the end of the day, which is probably the first person ever who said I would love 100 emails at the end of the day. But I would love to hear from everybody about how we can support your organization. Like, this is not a practice presentation. This is like, we have something, it's proven to work, and we want to support you. Patty asked, by training your library, does that mean you are using AI? We are using something called natural language processing. So the short version, and by the way, I'm a non-technical founder, so I'm going to do the absolute best I can when describing this. We have trained our library by feeding it basically every anonymized message we have ever received and ever sent and ever created. So we have like this giant library of like, you got to think we've sent like millions and millions of interventions. So we're trying to use completely anonymous messages for our library to determine sentiment. If you're familiar with sentiment analysis, so like what does this person mean when they say this? And then we have it auto deliver a message when our library can determine, oh, we think based on all of these messages that this person might benefit from additional support. So technically, that probably falls into the category of AI. Um, but I wouldn't say that this is like an AI first type of resource. This is like the messages are written by real people, reviewed by real people. We never send content that's AI generated. The only thing we do use is natural language processing to determine in whether or not inbound messages indicate that someone could benefit from additional support. But it's all anonymized and untied to any health information.
Thank you. Okay, well, I want to thank everybody for their time today. We will go ahead and hang on the line for just a moment longer if anybody's got any more questions, but we'll go ahead and shut down the recording. Again, we'll have that up on our YouTube in the next week or so. Do check out our YouTube channel for all of our, well, many of our past archived Flex Lunch and Learns. And thank you all. Have a great day.
Thank you, Ellie. Thanks everybody for spending your lunch with me.